Your teenage child has been diagnosed with functional neurological disorder, short for FND, and your teen is at the age of possibly driving or has been driving that has been impacted by this FND diagnosis and symptoms associated with it. As a parent, what do you do? Hi, my name is Dr. Lee. I'm a pediatric health psychologist and chronic pain survivor myself. My mission is to help teens and their parents resolve persistent physical symptoms such as chronic pain and FND so that they can get back to their life and feel like quote unquote normal again. Because I truly believe every teen who's been struggling with FND and chronic pain deserves so much better in their life. If you're new to this channel, welcome, and make sure to grab a free PDF parenting guide on how to help your teenage child at home who is struggling with chronic pain and FND. The link is down below. So today's video is all about FND and driving. Let's go through it. So when it comes to FND and driving, actually there isn't any guideline that would apply to everyone who is going through FND symptoms. I'll just say that because there is no one-size-fits-all when it comes to FND and driving or any other daily functioning for that matter. However, there is one article that came out in 2020. Actually, this was like right in the beginning of the pandemic for whatever reasons. And it is written by a group of people called ILAE, short for the International League Against Epilepsy Report. So here's what they did. What they actually checked if there were any studies talking about specifically PNES, which is a type of FND, psychogenic non-epileptic seizures called PNES. And so they were focusing mainly on the PNES and driving. And actually, they didn't find much of a good studies indicating a guideline. So they actually surveyed international expert opinion around this topic. And then did this joint analysis and made a quote-unquote driving guideline. And I say quote-unquote because it's not necessarily an official guideline, but this is like expert opinion kind of thing. So think of it as a one guideline and benchmark so then you can refer to what to do when it comes to FND, specifically PNES and driving. The most providers who participated in this expert opinion survey agreed on appropriate restrictions. However, the restrictions and then regulations should be based on, drumroll please, individual basis and the PNES characteristics. So like I mentioned, there is no one size fits all, therefore it needs to be all individual basis, but they also came up with somewhat of a benchmark slash kind of loosey-goosey definitions of what are some of the things that you have to think about, okay? So by definition, when they, meaning that these expert people say active PNES, that means any individual who has been having PNES episodes within the past 6 months. That is considered you having an active PNES, okay? And then criteria for not driving. So this is a recommendation for not driving, okay? And there are 5 of them basically. And then if any of the following is there, then the regulation basically says you shouldn't be driving. So number 1, when there is a PNES episode, if you have loss of awareness or responsiveness, then that's considered one criteria for kind of strike out, not driving, all right? And second one is if there was a history of PNES related injuries. So let's say you would have a PNES and then having secondary injuries like head injury and things like that. Third point is if there's no auras or warnings or otherwise predictable psychogenic seizures. So if you cannot tell when you're about to have PNES episode, then that's one strike against driving, all right? Number 4, if PNES semiology suggests that ability to drive would be impaired during the psychogenic seizures. So for example, like when you're having a seizures, you're also having this convulsive or thrashing limb movements or visual disturbance, then you shouldn't be driving. Okay, if this telltale sign of your PNES is unclear, then it is advisable only to consider the semiology as not disruptive if the patient has already a typical PNES while driving without experiencing any impairment in control of the vehicle or driving ability. So, long sentence is what that means is that if your PNES symptom also comes with other potential symptoms that would make it difficult for you to drive, then basically you're saying you shouldn't drive. All right. Last one, if you or your teenager, probably less likely because this is specific for teenager, but this article is for everyone who has PNES, right? So if your child, for whatever reasons, wants to be a commercial driver, then this article and people in the article are suggesting don't drive. Okay, so those are the 5 things. However, like I mentioned, because there's an individual basis, they also came up with who can actually drive, even if any of these aforementioned 5 criteria are met for your teenager. So number 1, active PNES per se is not considered a contraindication to driving. So there are 3 different categories in that one point, okay? So number 1 is if PNES happened exclusively at times when the person, your child, could not be driving. So for example, if your child is only experiencing PNES at nighttime in bed, for example, or only in school, or only in the morning right when they're getting ready for school, kind of thing. So your child's PNES cannot be possibly happening while driving. That's one. And number 2, that if PNES occur exclusively after exposure to specific triggers that they cannot possibly encounter while driving. So for example, if your child is only having PNES in a specific area where there is no window, for example, or if your child is having PNES episode specifically with certain objects or places acting as a traumatic reminder or something like that. So if your child's PNES episode is very tied to this specific place or time or situations that doesn't include driving, then your child might be able to drive. All right. A third one, if these PNES are always preceded by a sufficiently long prodrome, allowing the person to pull a car out of traffic and make themselves safe. So for example, if your child can tell, there is a telltale sign, like, well, my child always gets a headache before she experiences PNES or FND symptom, for example. So again, there is enough of a warning sign that your child is aware of, and there's enough time from that warning till the FND episode, so then your child is able to basically stop the car safely. If any of these 3 criteria are met, then it's considered the active PNES per se is not considered a contraindication to driving. All right? And then one more thing with that, these exemption criteria only apply if a patient has a well-established and stable PNES pattern. So for example, the pattern has been established for at least 12 months, and there are no other reasons why they should not be allowed to drive. So those are the considerations for someone who may be able to drive despite having quote-unquote active PNES status. So it's a mouthful of things to go through. So I'm going to have a link to the actual article of talking about in details, so you can check it out. This article right now is an open access. That means you can access without paying for the article itself. Okay. Again, FND is a legit condition and your child is absolutely not faking. And there is no set policy for FND and PNES when it comes to driving. Everything is sort of individually based, and you have to talk to a provider or doctor about pros and cons and risks and benefits about the decision for driving. Now, from an FND recovery standpoint, the basic recommendation is the more your child can get back to their life, meaning normalize their activity levels, including driving, and things like that, for example, going to school and playing sports and all that kind of stuff that is happening in daily basis, the better. However, it's not necessarily a blanket statement either. When it comes to driving, it's not just your child, but it involves other people potentially as well, right? So, first of all, how is your child's FND status? And is it actually safe to consider driving in a safe place? Do you need to take a longer time to go through the driver's ed or practice and things like that, to the point that FND symptoms are very well managed and get through that process of driver's ed and temporarily and then license? Or if your child wasn't driving already prior to having this FND symptoms and diagnosis, then can they go back to driving safely? So there's a lot of things to think about, and I wish there was one blanket statement to say yes or no, but it's a little bit more complicated than that. But hopefully this guideline will give you some sense and a benchmark as to what are some of the things to think about. But bottom line, reading this article is really about safety and confidence level for you as a parent and also as a child. Well, now your child might be saying, oh, of course I'm fine, I can drive, because they want to get independent. Totally get that. And you also want to validate that wanting to be independent as well. And it's okay to have an ongoing conversation about, what does that mean? What is the pros and cons? And where is a safe place for your child to start driving just a little bit while you're in the car with your child, kind of thing. So that would be one thing to think about. How your experience has been when it comes to your teenager and driving with FND. Leave a comments down below, because I really want to see how you guys are navigating this rather complex process and challenges. And I would love to know more about if there are any ideas and tips that you guys have been implementing that has been successful or not successful, so we can share with other people who are going through the same thing. Now, if you as a dedicated parent and your bright and compassionate teenage child are ready to take step-by-step actionable solutions to resolve FND and chronic pain, then you might be a good fit for my program. Schedule a call to talk to me directly by clicking the link below and see if you qualify for my program. Thank you so much for watching this video, and I will see you in the next video. Now, I also want to hear